I'm so very pleased to be joined by Lucy Perez, McKinsey Health Institute leader. We're going to talk about brain capital. I'm going to allow a few people to come in for a moment. Please do join us. Okay, we'll kick off. So, Lucy, thank you so much for being here with us. We really do appreciate it. We'll let a few people cycle up front. It's been a very, very interesting Her Power so far, so we're so glad to have you here with us.
Thank you for having me. It's also so exciting to be here in World Woman House, right? So, real honor.
Welcome to Her Power. So we're here to talk about brain capital and our brains, which is a very important topic. And I want to set the stage a little bit for all of us. These brains are our most essential organ, and we've been underinvesting in our brains at exactly the moment that they matter the most. So brain-related conditions account for a quarter of the global disease burden, and the impact on women in particular is immense. So we're going to talk about that and pull that apart. Closing the women's health gap also means addressing the gap in brain health, where conditions like depression, anxiety, dementia, and migraines disproportionately affect women, but yet women bear a huge amount of burden, and that's insufficient. So, despite advances in neuroscience, we still understand far too little about how our brains work, and we're going to talk a little bit about that today. One of the interesting tidbits that you've pointed out is that, to me, is that there is a lot of return that can be brought with investment in brain health. And I think the stat that you've given is that $4 in productivity for every $1 invested is the return on brain health. That's the yield. So we can directly link brain health to economic health. And that's something that we'd like to talk about today. So interestingly, you just released a report with the World Economic Forum, which I got an advanced look at. It's fascinating, talking about brain capital. So really keen to hear a little bit about more on that from you. And maybe we could just kind of set the level playing field on what is brain capital? What are we talking about when we talk about brain capital?
So thank you again for having me here to have this conversation, because indeed, our brains are our most essential organ. And what's really fascinating, when you look at value creation, we're really moving into a world where the things that we design, imagine, and connect with our brains are increasingly the sources of value creation, right? And so what is that economic asset? That is brain capital, the combination of brain health and brain skills. That, in a way, it's analogous. We talk about financial capital, physical capital. Brain capital is this value creation energy and, powerhouse, I would argue, in our economy that we've been underinvesting in.
Great. And when you talk about skills, tell us a little bit about the skills that you're referencing.
Yes. Because one of the things that we really get into this report as we were talking about brain capital is that brain health and brain skills really feed on each other. Healthy brains enable you to develop stronger brain skills, and vice versa. Good brain skills power healthy brains. Mm-hmm. And so what we mean by brain skills are those skills that, frankly, are the ones that make us human, right? We're talking about things like resilience, adaptability, cognitive and leadership skills that show up in how we relate with others.
Great. And why does this matter particularly now? Why in this moment of time?
Well, you may have heard the word polycrisis being used a lot more these days, right? And when we talk about all the challenges that we're facing, whether we're looking at geopolitics, right, technological advances, climate crisis, the list goes on and on, our brains are under stress, right? So thinking about how we nurture those brains and how we ensure those healthy brains and really embracing brain skills is of the essence.
And how significant is that gap with women's brain health? I was just referencing that earlier. Maybe you could tell us a little bit about how it undermines women's skills and participation in the workforce.
Absolutely. So 3 years ago, we started a collaboration with the World Economic Forum looking at the economic impact of investing in women's health. At the time, there was even a bit of a debate, how do we define women's health? Because for a long time, it had been narrowly defined as those conditions that are unique to women. But what that work showed is that actually, women's health is not just those conditions that are unique to women, but also those conditions that impact women disproportionately or differently. And when you start looking at the conditions that make up brain health, neurological disorders, mental health conditions, substance use disorders, you start seeing there's quite a few of them that impact women differently or disproportionately. You talked about some of them earlier when you were talking about anxiety, depression, migraines, dementias, to name just a few. And to date, we've spent very little energy and dollars in looking at sex-based differences in those conditions, and they're quite profound. And as a result, even though women live longer than men on average, people tend to think that must mean they're healthier, but they actually end up spending a lot more time in poor health than men do. And it is not at the end of life. It's actually during women's prime working years, ages 20 to 60. And a quarter of that gap, of that extra time spent in poor health, ties back to brain health conditions. The other thing that we are exploring in this report is not just women as the patient, but women as the caregiver. Because as you're probably aware, women bear the majority of paid and unpaid caregiving responsibilities. And when it comes to brain health, take dementias alone as an example, 70% of those caring for dementia patients are women. And so that's, in a way, the double burden of the brain economy, because you're taking those women out of the workforce in many times, and that's limiting their productivity, their choices, right?
And this is why it's an economic priority, not just a health issue. This is really the point that you're making.
Exactly, because we quantified the whole women's health gap to be at least over $1 trillion in lost economic opportunity every year, and a quarter of that ties back to brain health. Mm-hmm. So we're talking $250 billion every year that is being lost because we're not thinking and putting attention behind those sex-based differences when it comes to brain health.
Could you also maybe talk a little bit about, we're in the middle of a workforce transition in the age of AI. And specifically, I thought AI it's going to do all the thinking for us. We really don't have to worry about our own skills anymore. Why does this matter in particular for women and the skill set when it comes to the AI transition?
And indeed, this transition means there's a lot of reskilling that is going to happen. The World Economic Forum is estimating that close to 60% of workers are undergoing reskilling in the next 5 years. I don't think we've had another period of time where it's been that dramatic. And when you think about what does reskilling mean, it means learning new skills, right? That is all brain skills, right? It's how we learn, how we adapt to work differently. And so that is why it's so much of the essence that we're thinking about these brain skills. One of the pieces of research that we looked at is, in terms of embracing these new technologies, how often are managers encouraging their employees to do so, right? And there's actually a significant gender gap there. We saw that only 21% of women are getting that encouragement from their managers to embrace this, whereas for men, the number is 50% higher. So considering that women make up 51% of the population, depending on the industry that you're in, can be significant number of the workforce. In some industries, closest to 80%. Thinking about how to ensure the brain skills are there and the support is essential to realize that full potential.
That's great to hear. Can you and important for us to remember, and especially as a manager, I need to keep thinking about that. Maybe you could give us some examples. How do we redesign our systems? What's a way that we can? How can I rework my workplace with brain health in mind?
Yeah, and what's interesting, you say I, my, and indeed, we have to think about the individual, but not just the individual, right? It is how do we work differently as a team, right? And as an enterprise, how is work designed to really encourage and foster those brain skills? What we're seeing, employers do that's working well in terms of, one, making resources available, but really focus on taking away the stigma. With many mental health conditions, for example, for long, there's been a lot of stigma in the workplace around taking advantage of some resources that may be available. And you see executive teams increasingly helping normalize the conversation. That is, for example, one of those critical elements. It is making resources available today with technology. For example, there's sometimes the nudges that help you think, am I taking, a break when I need to, right? Am I getting, the right amount of sleep, for example? Sleep is the number one thing in my personal view, right? When it comes to what are the things that I am doing for myself, right? But then you think about the team and how workflows are redesigned. Oftentimes, we're seeing a lot of point solutions proliferating. That's a lot of cognitive overload as you think, okay, I now have a new tool for this, a new tool for that, a new tool for that. can get a little intense, right? Instead, the organizations that are thinking about how do I redesign that workflow end to end so that I am building into it the brain skills, right? I am helping make it easier to learn how to use. That's another big part. And how are we training managers, right, to notice and to be able to intervene much earlier? Because when it comes to brain health, there's so much that we know already about interventions that work. And so we calculated that if we deployed known interventions, we could already be unlocking over $6 trillion of economic productivity. Those are big numbers.
Those are big numbers. Yeah. Those matter. So I was asking, again, the I-me question. Yeah. So thank you for bringing me up to what we can all do, as managers. How about cooperating across kind of the ecosystem between boards of directors and shareholders and sector leaders in government, public, private, philanthropic, to make this more of a collaborative issue to focus on?
Anytime you're tackling a big problem, collaboration is of the essence, and this is also true here. In putting together this report with the WEF, we actually launched a Brain Economy Action Forum where we brought together organizations from all over the world, because the reality is you need all the different perspectives. You need the innovators who are spending time in some of the basic science, right? Policymakers, educators. You think about these skills, start with, young kids, right? And so that collaboration has been, I think, part of what we hope with this report is get really practical around what are the things that one has to do, again, as an individual, right? For example, as part of a team, it can be your employer and more broadly in society, right? Because if we tackle this by thinking about, on one hand, safeguarding brain health, right? Fostering those brain skills, continue to study, invest, and mobilize for brain capital, we can unlock all this.
Okay, I like that. I would love to understand a little bit more about one of the things that I thought that was interesting in your report was about research and measurement. Mm-hmm. And I'd love to know a little bit about the key metrics we should look at to track progress. How do we know if we're doing this right, if we're moving the ball forward and focusing on brain capital and investing in brain capital?
And this is where I will start by saying something you're probably going to be, I'm not giving you the one answer. There's one metric, and that is the magical metric. We don't have the one. There are, different metrics at different organizations, again, aligned with their own objectives and what they're solving for, and different communities, because it is not the same thing when you're thinking about the brain capital of an organization that's focused on employees, let's say, ages 22 to 65, whereas, society looking overall. But it is, again, looking at this metrics of understanding the presence and absence of disease, right? That's one. Learning agility is something that a lot of employers, particularly these days, are really keen to measure and understand, recognizing with the plethora of new tools coming available, how ready is my organization to take those on?
Okay, so those are some good ones, actually. I'm not disappointed in that. And maybe you could talk about a little bit where you see brain capital thinking kind of influencing investing decisions now. Is there money being put against this right now? And any examples you could share with us would be super helpful.
Yeah. So I think what is really exciting, even in this WEF meeting, we can see it, how many different convenings are happening around this topic, right? And how it's bringing together investors from both public, private, and social sector to put real money behind this, right? One of the early ones was the Coalition for Mental Health Investment. They were here in Davos last year already making big announcements and bringing together players like Wellcome Trust, Kokora in Africa, so quite a few organizations, and we're just seeing continued addition to that. I think what is really interesting is that you're also seeing right from, like, as you look at in the private sector, whether it is the focus that several pharmaceutical companies are making in the neuroscience space, for example, or mental health or substance use disorders, that is an area that we anticipate seeing continued development of the pipelines in this area. I mean, earlier you quoted the 25% of disease burden ties back to brain health conditions, right? less than 5% of health dollars are going towards that. So that's a number
that's
we
inadequate.
expect to see
We
growing.
want to watch that move. Excellent. Well, with the return that you're talking about, that should help. I wanted to talk a little bit, just touch on the global issue also, because equity is important, not just between the genders, but probably also lower middle income countries versus more developed countries. So are there any ways that we can ensure that brain capital investment reaches those countries where the health gap, the access challenges are the hugest, really?
Yeah. And this goes back to my comment earlier that indeed we already know a lot about interventions that work, and that some that may be more effective for high income environments and some for low and middle income. But also the thing to think about, and I actually think brain capital and how we think about the brain economy, it presents some really interesting and attractive opportunities also for those low and middle income countries where we see a different demographic profile, right? A much younger population in many of these countries that you're like, this investments can help leapfrog, right? As we think about readiness to adopt new ways of working, new technologies, and making this intervention earlier in life can have an even bigger return.
And also a bigger gap in gender care, I would imagine, in those countries as well.
It depends on the country, interestingly. Yeah, it's not necessarily a blanket statement.
Okay.
Yeah.
So we're almost out of time, but I wanted to make sure we touched on one thing. You're raising awareness here at Davos, which is fantastic, and all of you can become emissaries for this as well. But if you could issue, it's very popular these days, folks who are in control, to issue executive orders. There have been a lot of those floated around. So if you could issue an executive order to leaders here at Davos about brain capital and gender equity, something they could try and implement this year, let's try and get tangible, what would it be?
So the dream, here we go, right? Like you said, we started with awareness, but this is how are we investing in the brains, in our workplaces, in our communities, in society. It starts with early childhood education, right? Because we're talking about this is a life course investment, but then it is, and this is why it becomes so important that we think about these opportunities to facilitate the public-private social sector collaboration. So I am very excited about those. And to your point on metrics, seeing that we're putting a lot more attention and intentionality behind tracking those metrics to making sure that we see this gap decreasing and realizing the full potential of the brain economy.
That's great. Well, we'll keep that in mind as we move forward in our discussions here at Davos also. But I really want to thank you for sharing your insights and your thoughts on brain capital. Where can we find the report so that we can access it and school up on this?
Making it, part of it is making it easy, redundant. So both on the World Economic Forum website and the McKinsey Health Institute website. Great.
So I encourage you all to have a look at that report. It is actually a fascinating read. We all, this all matters to all of us because we all have brains. It is our most important organ, and we need to exercise those skills. And I know I have quite a few takeaways here for our organization and how we think about reskilling, how we think about building skills, and making sure that we are accommodating for that and investing in our brains. So thank you so much, Lucy Perez, McKinsey Health Institute. Please, a round of applause for Lucy.
Thank you, Andrew, so much.